Well, good afternoon. I know that Dr. Mehdi just gave me a new CD for our presentation that contained 400 slides, so I don't know how much time you have, but we usually take days for these presentations. We'll try to do this quick and dirty, and at the same time, I'm sure give you as much time as you'd like because you probably have more questions than we have slides. I want to give you what are, I guess, my current thoughts on, generally speaking, nutrition, and that really is the basis for what makes the emu oil so important. And basically because we're all malnourished to degrees that we probably wish to ignore, avoid, not think about. I want to just give you some evidence for that and show you what happens when you do correct some of that malnutrition on a broad range of strategies, and I think you might be very impressed. And emu oil then is actually just a piece of that puzzle. So I want you to think a little more globally than the oil. Do I just... So this hopefully is a slide that you're aware of, hopefully from high school, just a list of what are the fundamentals of nutrition. These are the things that you need and need basically on a daily day. What I've done is I've grouped it by macro and micronutrients. I think that probably everyone here takes supplements or thinks about taking supplements. I mean, I do. Everyone taking supplements? So how many are taking a multivitamin? How many are taking a fat? A few of you are taking fats. You know, in an Emu Association meeting, I'm hoping you're all taking fats. How many are taking protein? 3 of us, 4 of us, 5. Protein is probably critical, and I want to emphasize that we really need to focus on the macronutrients, of which emu oil is a macronutrient. It's much less critical that you take micro. We're a drug culture taking society, and anything we can take in a pill we actually think is probably good for us, unfortunately. And so micronutrients in pills, and particularly as a single pill, is a worthless formulation. You can throw it away. That's a talk for another time. We have a short time here, but get rid of your one a day. I don't care who makes it, it's worthless. This is just to show you how important nutrition is. This actually is a recent publication, 2006, Dr. Willert, probably an internationally recognized expert on nutrition, comes from Harvard, probably publishes more per year than most of us dream about for a lifetime. He's extremely well versed in the topic, and he's pointing out that we could avoid within the United States 80% of heart disease, 70% of strokes, and 90% of diabetes simply by adhering to a proper diet, exercise, make sure your weight is okay, and avoid smoking. That simple little group of things that you should do, which you all know. I'm not telling you anything new. This degree of benefit exceeds, probably by an order of magnitude, what you can get from a pill. And yet, we think that there's a solution to these problems in a pill. A pill only comes close to helping. It doesn't achieve this degree of benefit. This is just to take another look. This comes from this publication, Circulation, which is one of the major publications of the American Heart Journal, again, 2006, just showing that if you do, again, those items that I mentioned, plus taking drugs for those problems, you still have a significant benefit solely as a consequence of the diet and exercise, not smoke, etc. So that's how critical is the situation with weight. The Dr. Willett that I mentioned actually runs the Nurses' Health Study, 84,000 nurses. There are a couple of these studies. This is started in 1980, tracking these individuals. You would think nurses might be, if you will, a biased group. They might be a little healthier than the rest. And that's a criticism of the study. Again, those that are on the Mediterranean diet, not smoking, et cetera, 82% avoided that. Here's the kicker, and this is what really is most important to you, is that only 3% of the women in that study met that critical criteria of weight, diet, exercise, and not smoke. So the 97% of us, probably everyone in this room, are subject to those increased risks because we don't adhere to what it is that you already know. But the flip side is that because everyone is by and large so unhealthy, even though we probably think otherwise, we're then susceptible, if you will, to the benefits of correcting that malnutrition. And that's the good news. And therein is why we get such a great benefit and such a varied benefit from correcting these problems, these nutritional problems. Some we can correct topically, some we have to deal with systemically. This is a slide that's meant to show that as we get older, and beginning at age 25, our skin is synthesizing less. In this case, I mentioned triglycerides, fatty acids that are connected in a glycerol compound. That's the concentration of products that you just saw. That's emu oil. So as our skin makes less of that, we are faced with a lot of problems, skin dryness just being typical. What most critical in this piece is that emu oil or triglycerides are just one piece of the puzzle. The rest of the puzzle are sterols and ceramides. Those are the other fats that our skin needs. These are the other markers that go along at the same time as a function of age and declining function, whether it's wrinkling, sagging, loss of elasticity, dryness. These are sort of characteristics of aging and the characteristics of a loss of these fats in the skin that's just a function of aging. The problem is it's accelerated by this issue down here, microvessels. The UV damage reduces blood flow to exposed areas of the skin, and that's why you see in the elderly the bruising. That's a loss of blood flow. It's up to 40% decline in blood flow. You just heard the critical need for blood flow and health, only it was in the context of a wound. You can't heal a wound without the blood. You can't have a healthy skin without the blood. So that anything that we do that improves blood flow to the skin is actually therapeutic. And so, in fact, there are a lot of processes that we deal with, peels and the like, whose purpose is basically to improve blood flow. Anytime you do that, your skin is healthier. These are the fats, sterols, fatty acids, and ceramides that are turned on. The synthesis of these is turned on as a consequence of anything that disrupts the skin barrier. A wound is obviously a disruption of the skin barrier. Most important, the first synthetic step that's turned on are the sterols. So in fact, your skin needs cholesterol, which is a sterol, and it needs more cholesterol than it needs the fatty acids. And it's the system that's turned on first. You all know the bad cholesterol. Our skin actually needs a lot of bad cholesterol. There is no such thing really as bad cholesterol. It's just that too much and too much oxidized might be a problem, but we need cholesterol. It's a critical substance in the body. So if we take, instead of putting emu oil on someone, we put a mix of all those fats, you actually get accelerated healing. This is a post-op infected incisional site that's just after 3 weeks, solely applying those topical fats. Next. That was a patient of Dr. Dean's. This is his nurse. You probably think Dr. Dean did this, but this is a laser resurfacing, and then that's a picture after 1 week, just using those topical fats. Next. Next. You all know Jeanette, I hope. Jeanette's really what got us started because she used one of our products in which the results were quite remarkable. They were so remarkable that we have to have made a video so people can see that, in fact, she's real and that these arm pictures that we have are true, because it's hard to believe. So Jeanette at this point is 85. Her skin's remarkably well preserved. Next. What we started with, which first appeared to me at the meeting we had in Biloxi, and that's when all this began. She came back with this, this is after 9 months in the middle, 4 years. Next. This is 6-year picture down at the bottom. She's coming back August 15th for her 7th year picture. There's progressively better pictures each time, solely replacing the topical lipids. Nothing else with Jeanette. This is just the fat story. Let me give you another piece of the story. Next. These are just a quick series of pictures before and after, 2 to 3 months, pictures from Dr. Mene, of replacing protein only. So this is the other piece of the puzzle, the other macronutrient that, by and large, 60 to 70% in this room are deficient. You may be big eat meters, for all I know, but you're probably not getting enough. And if you don't get enough for the other micronutrients, you can't utilize the protein that you take in the diet anyway. Nutrition is about balance. It is critical to have a little bit of everything, not too much of anything. It's a simple, non-sexy story, but it happens to be the problem and the truth. Next. Again, there's weight loss in some of these people, but what I want you to do is focus on this area of the neck underneath the chin, and you can go home, look at yourself in the profile, and if you have this look, you know you need to add protein. If you're younger, you don't have the same diagnostic criteria, and it's a little harder to tell. Next. This is a gentleman, no weight loss, but you can see, again, this aspect of the changes. The sagging of the skin. What I tell folks, particularly the estheticians that we work with, most signs of aging are signs of malnutrition. You dramatically change people's appearance and health by correcting their malnutrition. We all know that, but we don't know how to quantitate it. So I'm quantitating it for you in pictures so that you can see on the surface what happens. And if this is what's happening on the surface, the same thing's happening elsewhere. And so this is a pictorial statement of this. Next. Again, you can see this pronounced change that occurs, particularly in the chin area. You know, as you become protein deficient, the sagging is a consequence of loss of muscle support for the skin. And so you increase your protein, you're going to restore that muscle function. You can do some facial exercises Dr. Mene can show you, and you can enhance this a little better. You can look in the mirror and smile, take your protein, look in the mirror and smile, and figure the smile you want, and work on that, and you'll correct defects in your smile and your appearance. It's just a simple exercise. It's not difficult. Nutrition is not difficult. We don't do it. We don't do the nutritional side. We don't do the exercise for whatever reasons, but it's critical to health and longevity and a reduction in all those chronic diseases, heart disease, diabetes, right? The diabetes is that epidemic in this country, and it's the one that's correctable up to 90% simply with the diet and exercise. 90%. Next. Next. Again, you know, you can still see the remarkable change that takes place. Next. Next. You can go to the USDA and you can get these reports by state looking at dietary intake so that if you want to see where you fall as a state, what the different deficiencies exist in the diet, you can go to that website. Next. Most important are the macronutrient problems. I list here that 60% deficiency, that's not defensible with the USDA. That comes from clinical reports looking at outcomes of patients admitted for events other than diseases. And so in a clinical setting, 60% of people have protein malnutrition such that it has a significant impact on the outcome of their treatment in the hospital. Twice the number die that have this deficiency than those that don't. That's the magnitude of the benefit of having adequate protein all the time. Next. Basically what's happening then is that you are what you eat. We all know that. You digest that you eat, and it gets reassembled. The critical elements, particularly from the lipids and the proteins, they're used to activate genes. They are the genes. In some cases, they regulate cellular function. These are all the different events that take place. You don't get healing of wounds, as miraculous as you know happen, without a very miraculous process going on. And that is made more effective the healthier you are. And the healthier you are is simply restoring the malnutrition. When you topically replace those fats, you correct the fat malnutrition. You take extra protein, you correct the protein. Your skin is 75% protein. You can't have adequate healing if you don't have adequate protein. It's just a simple fact. There's no ands, ifs, or buts, and protein's cheap. Next. These are the classical signs of fatty acid deficiency: poor wound healing, hair loss, dry skin, and eczema. This has been known for 50 years. There's nothing novel about any of this. It's classical information. Next. Here's the problem. I'm probably speaking to the group that don't want to listen to this piece of the puzzle. A Mediterranean diet, which is the diet that gives all these benefits. You don't mind the top? It's the low intake of dairy products and meat. High intake of, moderate intake of fish. You even allowed a little alcohol. Next. The lipids that we need to avoid, saturated. Most of those also come from dairy. Trans fats come from the food industry. And animal fats. We need plants and unsaturated lipids. Next. It's just to show you then what happens in some other cases. I told you that most of the physicians that we show the pictures to can't believe the results. I'm sure it's the same thing from our previous speaker. There's, when you're doing things that are off the beaten path, it's a high-risk maneuver in medicine. People don't believe the cosmetic benefit. This is a wound benefit. This is a patient that has a squamous cell carcinoma responding to this topical group of lipids. The last thing I want to go and tell people is that you can treat carcinomas this way, because they're not believing what we have to begin with. But it is amazing what happens, and I have no idea whether or not you treated another 10, you would get any benefit that had a carcinoma. But these things happen. It may be that in this particular this individual, the lack of these fats contributed it, and they enabled this process to heal. Next. The same individual showing the scalp problems and just UV damage, and I'm sure UV-associated problems with induction of that carcinoma. Next. Next. This sort of sad case is an individual that was referred to Dr. Mene. He was treated by a plastic surgeon, and he had fillers placed in for lines and wrinkles, and then followed with a fairly strong peel, chemical peel. And so the compression caused by the fillers and impaired the blood flow. And so the consequence of the trauma from the peel was to create this necrotic process, and that's gangrene in that dark area. And so you can imagine the chagrin and the panic that exists in a situation like this. And then you can just see the sequence of events. Again, just with topical application of the lipids. Next. So let me let you hear from Dr. Mene.